Drug delivery is an emerging field focused on targeting drugs to a desirable group of cells. The goal of this targeting delivery is to transport proper amounts of drugs to the desirable sites, such as tumor and disease tissues, while minimizing unwanted side effects of the drugs on the other tissues. Blood-brain barrier, or simply BBB, is an essential physical and biochemical barrier that separates the central nervous system from the peripheral circulation. This barrier is primarily formed by endothelial cells that interact with each other to maintain CNS homeostasis. However, the majority of drugs and biotechnological agents do not readily permeate into brain parenchyma due to the presence of BBB and blood-cerebrospinal fluid barrier. This, therefore, has become the most significant challenge facing CNS drug development. There are three transport mechanisms across the blood-brain barrier: passive diffusion, carrier-mediated transport, and endocytosis-transcytosis pathway. With passive diffusion processes, only lipid-soluble, small molecules with a molecular weight less than 400 daltons can cross the blood-brain barrier. Carrier-mediated transport processes involve putative proteins that facilitate the movement of poorly permeable solids across cellular membranes. Endocytosis-transcytosis processes allow the internalization, sorting, and transcellular trafficking of many plasma macromolecules. These processes can be either absorptive or receptor-mediated. The knowledge of nanoparticulate therapeutics (BioFaith) is essential for maximizing therapeutic effect while minimizing unwanted adverse effects. Nanoparticles are colloidal systems with compact structure where the therapeutic agent is either entrapped within the colloidal matrix or coated on the particle's surface by conjugation or adsorption. Because of their compact nature, many nanoparticles can provide sustained, controlled drug release. Nanoparticles are mostly made of polymers, lipids, or a combination of both. Some of the applications for nanoparticulate therapeutics include HIV, brain tumor, acute ischemic stroke, and neurodegenerative disorders. Upon primary infection, HIV can permeate into the central nervous system and actively replicate in brain macrophages and microglia. Since the majority of antiretroviral compounds are unable to achieve effective brain drug concentrations, HIV can eventually form an independent viral reservoir. HIV and central nervous system reservoirs, which is protected by the blood-brain barrier from exposure to high antiretroviral drug levels, often can develop drug resistance and presents a potential to reinfect the systemic circulation. This in turn ultimately results in overall treatment failure. Delivering chemotherapy to brain tumors using nanocarriers presents an attractive approach to resolve this matter. In acute ischemic stroke in vitro studies, the targeted streptokinase nanoparticles have been found to produce a 30% decrease in clot volume in 1 hour at much lower levels than free drugs.